Good morning. My name is Eric Hancock, and thanks for showing up. I wanted to talk to you a little bit about my capstone project, which is a thesis over drive-through and telemedicine, how COVID-19 changed healthcare delivery. This is a project I'm doing to complete my master's degree in healthcare administration for Claremont Lincoln University. Before I do anything else, I want to talk about my favorite subject a little bit, which is myself. So I'll tell you a little bit about me. Education-wise, I have an associate's degree in business, a bachelor's degree in management. I have spent my career in oil and gas manufacturing as a manager for Halliburton and Boots and Coots. Other than the last couple of years, I have begun to work in education as a job placement coordinator at a technical school. I help students with employability things such as resume creation. I talk to them about employer expectations, how to look for a job, social media do's and don'ts, and things like that. I've been married for 35 years to my high school sweetheart, Paula. She's my #1 supporter and my ride or die. I love her to death. I have 4 children. My oldest is a paralegal and she's about to start law school. My middle daughter is a principal of an elementary school. My youngest daughter is an LPN and she travels for work. And my son is in the Air Force. Hobby-wise, I love to play with remote control cars. I travel all over the country racing those. I build hot rods and show trucks and things like that. So really, I'm a kid at heart, and I don't intend to change that. But let's talk about my thesis for a little bit. So the project was how COVID-19 changed healthcare delivery. What was the impact to healthcare consumers? What steps did healthcare providers take to mitigate the threat of COVID-19 to both their staff and to their patient pool? And one of the things that really intrigued me was how did providers come to the decisions that they did for mitigation tactics? And one of the reasons that I was really curious about that is I have a background in Lean Six Sigma, and that's all about reducing waste in any process. So I dug into that a little bit. And in my thesis, I talked about kind of how Lean started with Henry Ford and his assembly line processes to W. Edward Deming, who took it to another level. And then there are a couple of international Lean gurus that really helped change and promote the Lean Six Sigma ideology, primarily at Toyota, a man named Shingo, and then there was also Taiichi Ono. And all of those are kind of known as the fathers of Lean Six Sigma. As I said earlier, it's about reducing waste and becoming efficient in any process, and that applies to healthcare, to manufacturing, to education. Those processes are good for any business. So what was the impact to healthcare consumers? And that's the issue that I wanted to dig into first. So I created an online survey that I published through my Facebook and Instagram channels. I'm pretty fortunate. I have quite a few friends on there through both my business and personal stuff. And I asked a series of 6 questions about how COVID impacted their personal experience with receiving healthcare. And the first question that I asked was, what is your age range? And this was the only kind of demographic question that I asked because I was just curious. And most of the respondents that I got to this survey were over 35 years of age. And fully more than half, about 52, almost 53%, were in the 35 to 44 range. So I didn't get young people particularly. I got a few less than 5 that were 25 to 34, but mostly it was more mature individuals that responded to the survey. The second question that I asked was, has the COVID-19 pandemic made it more difficult, less difficult, or is there no change to receive healthcare services for yourself and or your family. And a little over 60% of the people that responded to that survey said that COVID-19 has made receiving healthcare more difficult than it was before. Not one individual that responded said it's less difficult. Now, almost a third said that it's not more difficult, that there has been no change, but the majority said that it's more difficult to receive healthcare in the midst of this pandemic than it was before. The third question I asked of consumers was about time commitment. How much time does it take for you to receive the healthcare services that you require during the COVID era? A little over 55%, which is beyond half, said that the time commitment required is greater than it was before. And that's going to kind of lead me to a bit of a quandary when I asked one of the other questions. And this is it. So have you had a virtual healthcare appointment via Zoom, Teams, or other telemedicine app? And the tech portion of respondents that say they have used a modern app like Zoom or Teams or something to actually participate in their healthcare choices was a little bit over 63%. But still, you had 55+% say that the time required is more. So that's a bit of a quandary for me, because those things like Zoom and Teams, and one of the benefits of the technology that we have currently in healthcare is to reduce the time commitment required. So that answer about the time commitment and the usage of technology was a little bit unsettling for me. Maybe unsettling is not the right word, but it raised some red flags for me. The fifth question I asked was purely an opinion. Obviously, some of the other questions are subjective as well, but I asked, do the processes put in place, such as mask usage, social distancing, things like that, by providers to minimize COVID-19 risk to patients and their teams, does it make you feel more safe during an in-person visit? And the overwhelming majority, more than 2/3, said that it does not make them feel safer, which is really odd to me. So when I talk to the providers and the decision makers in healthcare, I'll get to that point here in a minute. One of the CEOs at the largest hospital that I talked to had an observation that really opened my eyes on that. But 2/3 of the people say the mitigation tactics did not make them feel safer. And then I asked, do you think that those tactics put out by healthcare providers to mitigate the risk of COVID-19, do you think those tactics should be made permanent? And the consumer responses, again, about 2/3 of those people said no, they should not be permanent. So that's the questions that I asked of the consumers. And then I went to the providers, and I was able to interview 5 different providers, and there were a few CEOs, 3, one marketing director for a large hospital chain, and then a director of a pharmacy for a government agency. And I got some of their responses to a few questions that I asked them that was pretty eye-opening. The first thing I asked was, how did your organization decide what protocols to use to help decrease the danger of COVID-19 to staff and patients? And with that question, across the board, all 5 of them said that the immediate response when COVID-19 first showed up on American shores was to follow CDC guidelines. And every entity did that. That was the choices they made. They didn't do any of their own work to see what worked for them. They just followed the CDC guidelines. And then I asked, Does your organization have a formal continuous improvement process? And this is where Lean Six Sigma comes in. We're living in a time where Lean Six Sigma and continuous improvement are really hot button topics. It has become very widespread in all kinds of industries to have a formalized process for continuous improvement. And I was curious, once those CDC guidelines come out, did the individual entities that I spoke with, were they using their own continuous improvement processes? And 3 of the 5 organizations said that they do have a formal continuous improvement process. The largest hospital, the actual 2 largest hospitals, both are part of a greater organization. They have Lean Six Sigma staff available to them, if not on site already, that can come in and look over their processes and help them with those things. The CEO of the small clinic that I talked to did not have a formal continuous improvement process. They're a very small organization, so they weren't able to do that. The government agency is like those 2 large hospitals. They have access to Lean Six Sigma experts, and so they use those. The smaller of the 3 hospitals does not have a continuous improvement program. Their quality program leads those initiatives, and they are working towards currently getting someone in that role on staff. So I asked them a couple of other questions about the effectiveness and their opinion of the effectiveness of their tactics on mitigation. And I got basically the exact opposite response from the providers as I got from the consumers. And that's not necessarily surprising. I said, do you think your patients feel safer because of the COVID-19 mitigation tactics your facility employs? And 4 out of the 5, 80%, believe that their patients feel safer because of those mitigation tactics that they use. And that's the exact opposite, again, of the consumer group. But curiously, the one person that said no, they did not feel that their patients experienced a safer feeling because of the mitigation tactics was the CEO of the largest hospital. And I really think he may have his finger on the pulse of his patient pool a little bit more than the others do. And I'll talk about that a little bit more here in a second. And then the last question that I asked is, should the mitigation tactics used by your facility to combat COVID-19 become permanent? One person said yes, and that was the CEO of the small clinic. The other 4 were undecided. They all believe that they should let the pandemic decide that. If the transmission rates and hospitalization rates and all of those numbers are low, then they feel they can relax those mitigation tactics. If those numbers, the transmission rates and things like that, go up again, then they believe that they should put those back into place. But they want to make the healthcare experience as easy for their constituents, their patient pool, as they can. So, project conclusions. I first want to make an observation about the one CEO and the mitigation tactics. He made an observation that stuck with me a little bit. We live in a rural kind of Southern Republican area, and it's sad to me that a healthcare crisis is political. But that CEO mentioned that if we follow the demographics kind of our political, I'm trying to choose my words carefully here, of our political parties in our region, which is, we can make a safe assumption that that's where most of my respondents come from, is our region, since I used Facebook to put that out. If we follow the politics of our region, the breakdown of the mitigation tactic statistics follows fairly closely along with the alignment of political parties here. And again, I think it's pretty sad that a healthcare issue has become political, but when he mentioned that to me, it really resonated. And as sad as that is, that's kind of where we are right now. So project conclusion: consumers that responded feel that COVID-19 has made it more difficult to receive healthcare services. Consumers feel it takes more time now to receive those healthcare services. More than half of the respondents have used advances in telehealth technology to receive healthcare services since the pandemic began. And most respondents do not want the mitigation tactics to be made permanent. Again, there may be some politics involved in that in our region, and that just kind of is what it is. The providers used CDC guidelines for their tactics initially, then began to use internal processes instead of a one-size-fits-all approach. And they used some Lean Six Sigma processes to get away from that one-size-fits-all. All of those that use those Lean Six Sigma tools mentioned that they use flowcharts to get a current state map of how those processes work. They had planned out for a future state map how they wanted the process to look in the end. And then they used the plan, do, check, act process to see the validity of those processes. So plan, do, check, act means you come up with a plan, you do the plan, you check your data to see if that plan is working. If it's not, then you act in order to change that process to make it more equitable or to make it work for the situation that you need it to, and then you do it again. Plan, do, check, act is a basically never-ending process. Sustainability is the hardest thing to achieve in any new continuous improvement initiative. So it's important that you always go back and check. And then providers were undecided if mitigation tactics should become permanent. They want to let the disease, the virus, dictate the mitigation tactics that are used. If transmission rates are low, you can drop those things. If they come back up, then you need to reinstitute those things for us. As far as recommendations, always be sure that your staff and patient safety is foremost in any decision-making process. This is the number one thing we can do, is try to keep people safe. When you're making those decisions about mitigation strategies, include all of your stakeholders. That would be your administration of your facility, your staff and team members, as well as your patient pool. All of those people should be involved in the decision that you're making on mitigation tactics. Then evaluate suggested guidelines before implementation by examining the most current pandemic data that is available. And that just should go without saying. We need to know where we're at to know where we're going. And that's another lean principle. And I throw this up there because that's something that I live by. It applies to anything you do. And I always tell our students, plan the work and work the plan. If you know where you want to get to, put a plan in place, write it down, and work towards that. This is not really a TED Talk, but anyway, thanks for coming to my TED Talk. I appreciate you, and I look forward to interacting with you.